Hey, Dr. Essen, can I get you in here, please?
Sure. What's going on?
I think I might have a STEMI. I've got ST segment elevation and 2-3 AVF. My patient's blood pressure is 90/40, heart rate of 52, O2 sat at 92% on room air, and we're having chest pain of 6 out of 10.
Okay, let's get another nurse over here. Gary, you got a second? We got a situation here. Look, I'd like to see if we can get an IV started on her, get some fluids going, and let's get an O2 cannula on her. Let's keep the sats at 94% or higher if possible. I need some stat labs. Let's get a CBC, PT-PTT. Let's get a chem panel. Let's get some troponins. Let's get her started on some aspirin, 325 milligrams. I'd like some nitro going at 0.4 milligrams, Q5 minutes times 3. Let's give a bolus of heparin, and let's start her on the heparin drip protocol. Got it? Good. Regina, have you given those medications yet?
No, I wanted to get my labs labeled and sent off for baselines first.
Okay.
I'll give them here in just a minute.
Okay, great.
Hey there, how are you? I'm Gary, I'm one of the nurses here. I'm here to give you some medications. Mrs. McCarthy? All right, Kim McCarthy, can I just take a look at your ID band? Great, all right, see we got this IV going. Tell you what, I'm going to just flush your line here. And I'm going to give you some heparin, all right? It's a blood thinner. And then we're going to be giving you some through your IV continuously. Got some pills for you to take here. If you would just sit up for me. Can you do that? Great. The first one you swallow like a normal pill. There you go. Great. And then the second one is you just put that under your tongue. It'll dissolve there, and that should make that chest pain go away. Okay. So I'll be back to see how you're doing.
I'm going to finish up.
You doing okay, Erin?
Yeah, thanks.
All right. Great.
Oh, hey.
Hey, I got a question for you.
Sure.
I just wanted to ask you about the patient
Hey, Miss McCarthy, it's Regina again. How you doing?
I'm better.
You've been better?
Okay, let me finish this up.
I've got some medications to give you. Can you please tell me your name and your last four?
Kim McCarthy, 1238.
Okay. Here's what I'm going to do. I've got a pill for you to take right here. If you can just swallow that one for me.
See you later.
And this one will stick if you'll stick that one under your tongue. And I've got some heparin here I'm going to give you. And that's a blood thinner, okay? So I'm going to give you that heparin.
Better than I think a lot of anxiety she's dealing with.
Hey, Regina. What are you doing?
Give the medications.
I already gave those.
Well, I didn't know that.
Now let's take a look at the same situation, but this time with the effective use of closed-loop communication.
Hey, Dr. Essen, I can use some help in here.
Sure, what's going on?
I've got a patient with a possible STEMI, ST elevation 2-3 AVF. Blood pressure is 90/40, heart rate of 52, and O2 sat at 92% on room air.
Let's get another nurse in here. Hey, Gary, can you give us a hand over here?
Yeah, sure.
We've got a situation here. I'd like to see if you can get an IV started, and let's get an O2 cannula on her. I'd like to get sats maintained at least at 94% or better. I'd like to get some stat labs drawn. I'm thinking CBC, PT, PTT. I want to get chem panel and some troponins. Let's start her on some aspirin, 325 milligrams, some nitroglycerin, 0.4 milligrams, Q5 minutes times 3. And if the chest pain doesn't subside, let me know. Let's give 5,000 units heparin bolus, and let's start on the heparin drip protocol. Got it? Good.
Hold on just a second. Mind if I just review that?
No,
with
not
you?
sure. Go ahead.
Okay,
Sure.
great. So that's O2, 2 liters nasal cannula to keep O2 at 94%. Stat labs, a standard panel, CBC, coags, chem panel, and a troponin. Aspirin 325 milligrams times 1, nitro 0.4 every 5 minutes times 3. I'll let you know about the chest pain.
Sure, thanks.
5,000 unit heparin bolus, and then we'll do a standard heparin infusion.
Oh, perfect. Great. Thanks. Got it.
Regina, I'll get the medications.
If you get the labs.
I've already drawn the labs and got the IV started. I just want, per the stemming protocol, I just wanted to confirm what we wanted.
All right, great. Aaron, you've got
I'll get
the
those
eyes.
run.
Oh, great, great,
All right,
great.
great.
Thanks.
Hey, how are you? I'm Gary. I'm one of the nurses here. I've got some medications for you. First thing I want to do is check your ID band here. If you would, just give me your full name and your last four.
McCarthy 2848.
Okay, that's you, Kim McCarthy. How you feeling? Still having some chest pain? All right, I've got some medications to give you. The first thing I'm going to do, if I could just have your IC. They started your IV. Hey, Dr. Esser.
Yeah.
Just want to let you know the meds have been given. The only thing we need to do is set up the heparin drip.
Oh, great. That was fast.
Labs have been sent, and I actually did a bedside eye stack for troponin, and it's 3.2.
Oh, perfect. Thanks. Really appreciate it.
Anything else?
Yeah. Can you check on her? I just gave her the nitro because I need to check on my other patient.
Okay, I'll follow up. Hey, I just wanted to follow up.
As you can see, the use of closed-loop communication can prevent errors. Verifying that information has been heard and understood and that actions have been completed keeps all team members informed.